So I am the manager of the Children, Young People and Families Service in RNIB in Northern Ireland. RNIB supports children and young people with sight loss and also adults with sight loss. I manage several projects for children, young people and families, and included within that is the Family Insight project, which we run in partnership with Angel Eyes Northern Ireland. And it's a project for young people aged 0 to 12 with a sight problem, and the two main strands of that project are family support and education advocacy. I am the chair of the Reaching Out Supporting Families programme, and it's been a real pleasure to work with other grant holders on the steering group and outside of the steering group as well, to identify some of the key learning points that they want throughout the project and the learning that they can bring to us as a steering group as well. I would say that families don't really exist in a vacuum. So what we have found is obviously the presenting issue that a family will come to us about is that they've had a diagnosis, the parents maybe had a diagnosis of their child's visual impairment, and they're concerned about what that's going to mean for the child's future as well. And sometimes they're looking way ahead into the future and thinking what will happen when they go to look for work and what will happen at school, and it's maybe the child is a very young baby, so it's important to get them thinking about the baby steps and getting used to the diagnosis, learning more about the condition itself, and very importantly meeting with other families and other parents who've been through the process already, so peer learning is a big part of our project as well. I think the challenges that families face then are often similar to challenges that a lot of other families face who don't necessarily have a child with visual impairment, but we can have barriers like access to transport, difficulties with accessing education services or health services, or not necessarily knowing where to turn to for the support. I think the challenge for my team is they very much try to be the one central point of contact for a family, just so that they can make sense of the services and the new names and the new terminology that they have to get used to as families. So I think the challenges for my team are to support the family through some other issues which are maybe not specifically related to visual impairment, but also it's other issues in the family's lives. And I think the team are really they really do a huge amount of work in keeping themselves up to date about what other services are available, so that they're supporting the family in a holistic way. So the big challenge of our team is keeping themselves up to date with a range of different services that are available to the family, both specific to their sight loss and universal as well. Being a key contact for that family, being a consistent contact for that family can be a real help. The family knowing that they can pick up the phone, or at an event they can ask that key member of staff about something that's worrying them, and for the staff member to be able to say, okay, I understand what that service is that you're not so sure about, so I can tell you a little bit about that. Or if they don't know, being able to say, look, I'm not too sure, but I can go and find out for you. But knowing that you're the central hub there, that they always have a lifeline, if you like, some support that they can get whenever they need it.